In this section, I'm going to discuss the autonomic nervous system and stress responses. And we're going to take a close look at these two figures that you see here. And these come from an online article called Somatic Experiencing Using Interoception and Proprioception as Core Elements of Trauma Therapy. There's also a link there where you can access the full article. And I highly suggest reading this, especially if you are interested in trauma therapy. So in the image on the left, we see what happens to the autonomic nervous system under mild or acute stressors. So first of all, this vertical line represents the activation or the activity of these two different divisions of the autonomic nervous system. And then the red line represents the sympathetic nervous system, and then the blue line represents the parasympathetic response. We also see that there's this red lightning bolt shape, and that represents the mild stressor. So when we're under mild stress, it causes an increase of activity in the sympathetic nervous system, and that's going to release norepinephrine and adrenaline, and there is an increase of activity in that. Now, as that stress response diminishes, we see a decline in the sympathetic activity, and at the same time as that's happening, we see an inverse relationship of activity with the parasympathetic response. So when that mild stressor comes in, the parasympathetic nervous system is going to decrease in activity, and then it's going to start to increase in activity as the sympathetic response declines. Now, notice that there's what's called a parasympathetic rebound here. So the parasympathetic response, it comes up above its baseline, and then it starts to return to normal. Now, we're going to speak about the baseline in various contexts, and what that means is that we all have a different level of activity that our autonomic nervous system is operating at, and in our day-to-day lives, then we can refer to a baseline level of activity. Now, everyone's going to have a different baseline. If someone's been under a lot of chronic stress or has unresolved trauma, their baseline of sympathetic activity is going to be higher than a person that isn't under stress or hasn't had significant traumas in their life. So their baseline level of activity for the sympathetic system will be lower than someone that's had chronic stress. And we can see this in this other image here, where a moderate stressor or a chronic stress response, it causes the sympathetic activity to increase even higher. And then when it starts to decline, it never returns back to the baseline represented by the black horizontal line. Okay, so in chronic or moderate or intense stress reactions, oftentimes the sympathetic activity will stay elevated, and even after that initial stress response, it will decline, but it comes back down to a higher baseline. And this is related to the allostatic load that we talked about earlier, which is the wear and tear that develops on the autonomic nervous system over time. And so as you're repeatedly exposed to stress throughout your life, some of that stress is going to stay within the nervous system, and it's going to cause this higher baseline level of activity. And if you receive another moderate stressor, so we see this one moderate stressor here, but if you receive another stress response, then that can again cause that increase in sympathetic activity. And then when it declines, it's going to come down to an even higher level or a higher baseline of activity. Okay, so this has to do with the allostatic load that we spoke about earlier, because it has a cumulative effect on our body. Stress, especially chronic stress or intense stress, will have this cumulative effect that causes an increase in the baseline level of sympathetic activity in the body. And this is really important to understand because people who have been traumatized are going to have that higher baseline level of sympathetic activity going on in their bodies. And then this can relate to things such as cardiovascular disease and high blood pressure, even diabetes, and all of those types of disorders that can result from excessive activity in the sympathetic nervous system. Now, this stress response, it also relates to acupuncture, because when people receive acupuncture, then it's a mild stressor for most people, okay? Your typical average client, when they come in for acupuncture, they're not going to overreact or be traumatized by the needle. So for most people, when they get acupuncture, and even if they've had many sessions before, even still, receiving a needle is a mild stressor that causes a slight increase in the sympathetic response, and then that can rapidly decline. And when that happens, then the parasympathetic nervous system kicks in and it starts to rebound. So when you put needles in someone, they may be a bit uncomfortable with that at first, and that's causing that sympathetic response, and that's related to that. But then once you get all the needles in, and if you leave the room and give them some time and you come back in 10 minutes and they've fallen asleep, what's happening is the parasympathetic nervous system is starting to become more active. They're relaxing, and then we've had this good effect because we've helped to restore the balance of their autonomic nervous system and the balance between the sympathetic and parasympathetic divisions, okay? So this has many implications in the treatment of internal disorders, especially as they relate to the heart and the digestive system, the cardiovascular system, the reproductive system, and many of the internal organ functions in the body, because that parasympathetic response, remember, has to do with rest and recovery. And so this is one way in which we are benefiting our patients when we do acupuncture, is we're helping to regulate their autonomic nervous system and put the parasympathetic response into effect after they've received the needles. Okay, so this is really important to understand, because when you're doing acupuncture, you can also overstimulate people. And if you use too strong of needle technique, or if your electrical settings are too high, or if you use too many needles, that can actually be a moderate stressor and initiate a stronger sympathetic response. And during the course of the treatment, that sympathetic activity is not going to do what's represented here in figure 3. It's not going to decline below the activity of the parasympathetic response, okay? So too much stimulation, too many needles, or if you adjust the needles too often, then you can actually keep a person in that stronger, overactivated sympathetic stress response, and that's not a good thing to do. And this is something that I do see. I've just recently seen a patient who has seen another acupuncturist, and she has a thin body type and is really sensitive. She has a fast metabolism, and this acupuncturist was using a lot of needles and using electricity as well. And she said she would leave those sessions just feeling frayed and just on edge and jittery and nervous. And it was because of this activity that was occurring in the sympathetic nervous system. The acupuncturist was using too many needles, and the electrical settings were too high, and it would cause this sympathetic stress response. And then even after she left, she would comment that she would feel that way for even up to a couple days afterwards. It was just overstimulating to her. And this is exactly what was happening, is what we can see in the figure on the right. The sympathetic activity, it never returned to a more normal level, and it stayed in an elevated state, okay? So when I treated her, I recognized that she is a sensitive person and has a small body type, and she's also very responsive to just using a few needles. So I was able to just use 6 needles on her, and that was able to give her this response where we introduced a mild stressor. The sympathetic system kicks in during the initial part, but then even before the session was done, her parasympathetic system kicked in and it brought her to that relaxed state, okay? So in the next section, we're going to speak more about different body types and people's different levels of sensitivity and whether they're hyper responders or hypo responders. And when you understand that different people respond differently, then it's going to help you to refine your acupuncture technique even more. So we'll speak about that in the next section.